Hi, it's Merja here. One of the problems or the biggest challenges in people's recovery from a soft tissue injury is that, or even a joint injury, is that when they receive therapy, most therapists don't actually deal with any of the referred issues that any injury causes the body. Because if you think about it, if you think about the body as a block or a tower of blocks, if the injury causes one of the blocks to be drawn out a little bit, and then in order for that block to be balanced, another block needs to be a little bit more that way. So your tower of blocks kind of balances itself out. And when you deal with just an injury, you push in that block into that tower. The rest of the tower is still unbalanced because of the referred problems from the original injury. Now, a lot of therapists would go from isolating the injury and treating it into strengthening the tissue around the injury to try and support the site of the injury, which it makes sense, right? But the problem is that those tissues that they're now wanting you to strengthen are not recovered from the injury yet, and the strain that the injury has caused to that tissue. So just because the actual injury has been dealt with, it doesn't mean that there aren't repercussions for the tissue that is surrounding the site of the injury. So you don't, in order to actually have sustainable results from an injury recovery point of view, and moving the body further on even in more strength than even maybe it had before the injury even happened, you need to make sure that the body is on neutral before you start strengthening it. People usually laugh at me because, I ask them, have you been to Switzerland yet? Which means basically, have you brought your body to neutral yet before you start strengthening it? And most people say, no, I have never been to Switzerland. No, they say, no, I haven't actually even thought about it. That's never been told to me. Nobody's ever mentioned that I should take into consideration more things than just the isolated injury in my rehabilitation. So bring your whole body to neutral before you start strengthening it after the injury. And if you're not sure, talk to a therapist who has a holistic approach, so basically a therapist that takes your whole body into consideration, not just the injury that you were presenting to them. So yeah, definitely, if you're not sure, talk to people, email me or put a message across asking if I know somebody in your area who would be useful, or who you could trust to do a proper job in your rehabilitation. Most rehabilitation, if you only take the isolated injury, deal with that and then not deal with the issues that are surrounding the injury, what ends up happening basically is that your recovery from the injury is at maximum about 80%. So you'll be about 80% better after the rehabilitation from the injury if you only isolate the injury and deal with that. But if the possibility of another type of injury because of the soft tissue around the original injury site are a lot higher, because that was never dealt with. But if you deal with the actual injury and the tissue surrounding the injury, you can go from being actually healthier and stronger than you were even before the injury happened. But it does take a diligent approach, and it takes somebody who's dedicated to your well-being to help you with it. So look for quality therapists, and there's no reason that you can't continue feeling better and better and stronger in years to come.